For many people, visiting a fertility specialist is the first step towards a successful pregnancy. But before that, it can be a lengthy and sometimes frustrating journey. Knowing what to expect can help you navigate the tests and procedures more easily. The first step in overcoming infertility is to pinpoint the obstacles to conception. Are you ovulating normally? Are your fallopian tubes normal? Is your partner's sperm normal and functional? These are just a few questions that must be answered before your doctor can recommend an appropriate treatment plan. During the first consultation, your doctor will start a comprehensive fertility evaluation. Both you and your partner should attend this initial visit, as you will discuss your medical and fertility history, your concerns, and your goals. At this time, it will be useful to bring along all information regarding previous fertility treatments. Once these steps are completed, you will likely move on to a complete evaluation of your and your partner's reproductive systems. The female workup should start with an initial intake that includes a physical examination and a transvaginal ultrasound, which gives us a picture of your pelvic anatomy. Your doctor will also inquire about previous exposure to sexually transmitted diseases or STDs, abnormal pap smears, details of your menstrual cycle, acne, hair growth, pelvic pain, family history, medical conditions, previous pregnancies, recurrent pregnancy loss, and the duration of your infertility. In Canada, it is also routine to test for communicable viruses, such as hepatitis B and C, HIV, and sexually transmitted diseases. If your doctor doesn't find an obstacle to fertility through the initial exam, they might suggest further tests. Since a woman's age and the number of eggs she has in reserve are the most important factors in helping determine her fertility, your doctor might get you to do what's called a Day 3 FSH test. FSH is the hormone that stimulates the growth of the follicles that house developing eggs. An FSH blood test can give you a good indication of ovarian reserve and function. Your doctor can find out if you're ovulating by doing an ultrasound mid-cycle or by testing your blood progesterone level at the end of your cycle. Your doctor will order some blood work to test the numerous hormones that play a key role in fertility. If any of these hormones are abnormal, your doctor will discuss treatment. Next, your doctor might test your tubal patency to check that your fallopian tubes are open and unobstructed. An HSG X-ray or hysterosalpingogram is done in the first part of your cycle. This involves putting radiographic dye in your uterus and watching its course through your fallopian tubes. If the X-ray finds any abnormalities, your doctor may take a closer look with a hysteroscope, a tiny telescope. A sonohystogram is an ultrasound procedure your doctor might use, in which your uterine cavity is inflated with warm saline to allow your doctor to get a clearer picture of your uterus. If these tests can't determine the source of your infertility, the doctor may order a laparoscopy. A tiny incision is made in the abdominal wall, and this allows your doctor to examine your ovaries, uterus, and the fallopian tubes directly and try to correct certain problems. At the same time as the woman's initial tests, the doctor will start an evaluation of the male partner. This begins with a semen analysis to check sperm count, motility, and the functioning of a sperm. For men with no sperm in their semen, sperm can be harvested for the use with IVF without major surgery in sperm extraction processes known as testicular sperm extraction or TESE, percutaneous sperm aspiration or PISA, and microepididymal sperm aspiration or MISA. If no sperm is available, your doctor may discuss the possibility of using donor sperm. A hormonal evaluation of the male might follow the semen analysis, looking for imbalances as it did during the woman's tests. Once your infertility testing has been completed, your doctor will review the results and recommend a plan that may include one or more treatment alternatives, all of which will be discussed in the upcoming chapters.